Good morning. I'm just checking this microphone works, and I'm saying good morning.
Good morning.
Good morning. There's one person who's responded at least. And it is a good morning. It's great to be here. Thank you for coming. I think we may be having a few more people joining us in due course. It's a great pleasure to be here talking about booster shots for humanity's future. This is a subject close to my heart and close to the heart of our panel members here today. This gives me great pleasure to introduce Her Royal Highness Princess Lamia bint Majd Al Saud, who is the Secretary General of the Al Walid Foundation, Al Walid Philanthropies, I'm sorry, Mr. Rakan bint Khalid Al Doshid, who is the Assistant Minister for International Cooperation at the Department of Health here in Saudi Arabia, and a great partner of ours, and Nithya Ramanathan, who is the CEO of NextLeaf. So we're here today to discuss the subject that you can see behind you, here behind me rather, here on the screen. How do we get immunization to all of the world's children? Gavi is an alliance of partners, including the partners on the stage here, and it's our job to make sure that everybody in the world gets immunized, all of the children in the world get immunized, regardless of where they live. We work in the poorest countries of the world, 56 mainly, but other countries as well. And so far, since we were founded in 2000, we have funded the immunization of 1 billion children. And that has prevented 17 million deaths, 17 million. I think these numbers are very difficult to get your head round. They're so large. What does 17 million mean? But I think if you're a parent, as I am, you want to do everything you can to protect your children. If you're a grandparent, you want to do everything you can to protect your grandchildren. And I think if there are parents or grandparents in the audience, I know there are on the panel, then I think it's possible to understand what it means to protect your children with vaccines. So that's what Gavi does. We do it as part of a partnership which brings together funders, donor countries, philanthropists, implementing countries, experts on vaccines, our UN partners, WHO and UNICEF, as well as the private sector. And I think it's very important that we work as part of a public-private partnership to bring the best of the private sector and the public sector together for this great task. Gavi also hosted COVAX, which was the organization that funded COVID vaccines for the developing world. And Saudi Arabia, in fact, was a part of COVAX, both as a donor and as a recipient of vaccines, potentially. We think the COVID efforts saved 3 million lives around the world. And all of us who were part of that effort, I think, were proud of what we did, but we knew that we could have done better and that we need to do better next time. And that's one of the things I want to talk about today with the panel. So Gavi is facing some significant challenges, despite these great achievements that we've made with our partners, despite the great number of children who've been immunized. We face some pretty significant challenges. Some of these are global challenges that face the whole world, like climate change, which is helping diseases spread in new ways. So the mosquitoes that cause malaria are traveling away from the equator and up mountains. So not very far from here in Ethiopia, malaria is starting to be found higher and higher up mountains. And this is a big threat to our immunization efforts. We're also seeing climate change with severe weather impact, destroying health facilities in Mozambique, for example, recently, health facilities needing to be rebuilt. So climate change is a big problem. A part of our model is that countries pay for part of the vaccines. This is not charity, this is development. And the idea is to make the the vaccine programs in countries sustainable. So as countries get richer, they pay for a larger proportion of the vaccines. And that's challenging in the current environment. Countries have a lot of debt. They face a lot of challenges with food prices and other challenges. And that's a big problem for Gavi and for immunization. But there are also some great opportunities coming. I mentioned malaria already, and there are 2 malaria vaccines available now. Recently, just one announced that brings us a lot greater volume of malaria vaccines, allowing us to reach many more children with that vaccine. And that's a great opportunity for the next period. We roll this vaccine out. And similarly, we're seeing new technology in a range of fields, including the possibility of vaccine patches. If, like you don't like needles, vaccine patches have the potential to extend the range of immunization much further. So there's a range of opportunities and threats that we face, but I'm very pleased to have some experts here on the panel to help us grapple with these today. And I will, in due course, be opening up for questions. So if you have questions, please be thinking about what you would like to ask the panel. So first of all, Mr. Rakan, I'd like to turn to you. You're an expert in innovative finance, and this is something that's important for Gavi. It's been a key part of our work with the G20 that you were heavily involved in and where you made a great contribution. I'm keen to hear your perspective on what Gavi can be doing on innovative finance and how we can draw on the best expertise in this conference, in this arena, in this country, to progress our mission.
Well, thank you very much, and thank you for inviting me for this esteemed panel. And I'm very grateful for what you do for humanity as Gavi and for everyone's contribution to this noble cause. And perhaps let me start from the link of Gavi and this forum. And I think the biggest link is the engagement with the private sector. And the private sector is, in fact, very wide sector. Therefore, we need to work with them and in their multi-sectors. One thing, when we come to think of vaccinations and how we can ensure accessibility and equitability to vaccines, we wanted to make sure that there is proper mechanisms. And for those proper mechanisms to happen, we need to work more closely with the private sector. And I particularly mentioned the investment side, and we were discussing a lot how we can engage with, for example, asset managers. And I think what we can do is we can sit with them and open the portfolio of issues that we're facing and ask for innovative financing. One example is the special purpose bonds, perhaps an area that Gavi is looking for, and we need to sit with them and tell them, well, we do have this financial mechanism, and we wanted to make sure that they are yielding good return for investors and also good benefits that can help the cause where Gavi is moving forward. Another area where we are working much on is, as you mentioned, during the G20 and in the G20. So I think what the G20 have achieved is that we've brought ministers of health and ministers of finance in one table to discuss health architecture issues. And of course, one big part is climate risks and impact on this, and how we can make an impact policy decisions to ensure that we do have these links. And out of these outcomes, we've worked on evaluation and risk evaluation and how we can ensure we do have imminent financing for surge issues and emerging issues. We worked a lot in streamline the efforts that is happening between multilateral development banks and financiers to the programs Gavi have or any other international organization in that sense. So I think since 2019, the link between finance and health is established through the G20 task force. And in addition to that, we're also working a lot at the WHO in what it's called the Intergovernmental Negotiating Body, where we're discussing a lot of a pandemic accord and how we can agree on areas, especially in financing, knowledge transfer, and so many areas that cover health architecture. and in particular also climate change as well, and issues that are relevant. So again, the financing aspect is very important. We can link to policy making, we can link to engagement with asset manager and institutional investors. We can work closely with private sector and companies who provide this supply chain management. So I think there is the network is wide, and we need to make sure that the link is strong enough between two parts, health and finance, in that sense.
Thank you very much. We'll come back to some of the points you've raised later on, but I'd like to turn now to Nithya, and really you're an expert in data and managing data, but the way I like to think about your work is, we need vaccines to protect children, but we need Nithya to protect vaccines, because you're keeping the vaccines cold enough by doing the temperature sensing. So great to hear more about your work and how you've related to Gavi and our mission since you started working with us.
Yeah, thank you, Daniel, and thank you to everybody here. To give you some context, because what I do is actually quite technical, but I want to take a step back from that just for a moment to kind of explain how I got to this work of building sensors. When I was growing up, I actually spent a lot of time with my grandmother in South India for years, and I came into daily contact with people who were disfigured by polio. And this terrible disease impacts so many, and I was directly impacted by that. But unbeknownst to me, around the time that I was born, many decades ago, the world had decided to come together and actually launch a vaccine program and kind of agree that actually every child deserves a vaccine, including to diseases like polio. And so thanks to that program that was started almost 5 decades ago, now my 2 kids and your children will never know that disease. And that is an incredible accomplishment. And so that is the kind of thing that vaccination can accomplish. And so fast forward, when I started NextLeaf, my company, I wanted to work on humanity's biggest challenges. And I got a chance to start working very closely with the government of Kenya. And so we spent hours and hours in clinics, and what we found is that the most valuable service that was being offered that kind of brought people in initially was vaccination. Only there was a small problem, because vaccines actually have to be kept in a very carefully controlled temperature environment. So they have to be kept cold. If they get too hot, or surprisingly actually, if they get too cold, they won't work as well. And so this comes down to actually keeping refrigerators working. And this is an incredibly hard thing to do for a nurse who's working in a remote clinic in Kenya. So essentially what we did is we built out low-cost, small sensors that fit into a fridge, but were connected to the internet. And essentially what these sensors did was just send an alert when the fridge failed. Doesn't seem like a big deal. But the real insight, because we worked so closely with these nurses, the real insight was actually that you couldn't just send the alert to the nurse. You actually had to send it to her boss and to her boss's boss. And it's because of this interesting foible about people where we're not inclined to trust each other as easily if we don't know each other. But strangely, we're willing to trust sensors. So when a sensor calls for help, surprisingly, lots of people are willing to kind of jump into action and respond. And that's actually the insight that now helps keep fridges working and keep vaccines potent. So fast forward today, what NextLeaf does is we manufacture these sensors and data platforms at scale. We work with ministries of health to provide this kind of real-time intelligence about the supply chain across Africa and Asia. We have a very small team, but our technology is present in 30 countries and helps ministries protect the vaccine supply for 1 in 10 babies born on Earth each year. And that tremendous scale has been possible because of our close work with ministries and because of our work with Gavi. So partnerships have been really critical for us to get to that scale. And so now we deploy these sensors across vaccine supply chains. And now in front of us, we have to start thinking about what are the impacts of climate change on this critical work. And so for me, my compass is really pointed at resilience. And how do we help this data help communities build resilience? Resilience to climate shocks, resilience to expanding pandemics and outbreaks, and building out resilient infrastructure. And so even here again, we found data is the key to helping the people on the ground actually respond quickly to these quickly changing situations on the ground. And so our focus now is that we think about resilience in terms of really putting control in the hands of government, in the hands of communities, because ultimately they're the ones who are building the health supply chains and health systems of the future. And so actually one last thing I'll say is our final step is that we are looking to double our footprint to reach every country, all close to 60 countries where Gavi works, getting sensors in every truck, every clinic, every hospital, and ensuring that this data is in the hands of governments in order to manage these complex supply chains.
Thank you very much. That's so important. And we are looking to expand the network of cold chain, as we call it, so that vaccines can reach more children. 1 in 7 children around the world doesn't get any vaccines at all, and a much larger number gets too few vaccines to get them a healthy start in life. So this is a really important part of our work. Now, partnerships are at the heart of Gavi, and I know, Your Royal Highness, they're at the heart of your work as well. And one of the key sets of partnerships we work on is as a kind of incubator through our Infuse work. We help fund entrepreneurs like Nithya and others to bring new technology and new approaches to this vital mission. And very generously, our lead philanthropist has funded the Infuse program, and I'm really keen to hear your perspective on, why you invested first of all in Gavi and how you see the future going forward.
First of all, thank you very much for having me today. I would like to start just giving a quick brief about what we're doing. We're a foundation that's been working for 40 years. Actually, this year is our 44th anniversary. We work via our partner. What's required from us is strategize the work, plan, and put a clear KPIs and how we can have a humanitarian return on investment for our work. And that was very aligned with Gavi. Gavi, what we're doing with Gavi, or actually our portfolio from a vaccination perspective, I believe I would say 100%, because we actually last year we reached 700 million kids around the world with working with you and fund the Gates Foundation, WHO, and of course the UNICEF. What we see from how we can fund and how we can support the healthcare system, it's crucial if you remember the pandemic during the COVID time. Do you think if it's in one part of the world, it will just keep staying there? No, it will create a threat among the full globe. And this is why we should really understand the importance of partnership. Not only partnership, what's very exciting about Gavi and what really kept us going with Gavi is how you used your data. It's not only collecting the data and having it and have an open source for the data, the understanding and utilizing it for each and every community. And this is, again, a very crucial thing for partnership. Our, I would say, equation of success is how to utilize the governmental aspect and how to navigate through the corridors of the politics aspect of the story to make it easier for vaccination to reach certain communities, and how to use the local NGOs and how to support the local NGOs to navigate through the corridors of culture and the sensitive area of the vaccination, and how us to have a clear return on investment and return investment from a perspective of measuring impact, and how we can have a clear numbers and data for us to move forward, and how to narrow gaps and how to close gap in each countries. And this is where we collaborated in the first time, and how to graduate countries. And here you come how you used the data for Infuse. And this is something I'm very proud of, because I'll give you just one example. I've been to Laos before it was a very interesting case in Laos. Laos is a very small country, 6 million of population, 48 languages, 250 mountains, 6 months of rainy season. So I was very interested, because we're the main seed funder of eradicating measles and rubella. So I was very interested how they're managing to get up the vaccine in the right temperature to the mountain. And I went there, and it was a very difficult procedures and a way for them to get up to the mountain, convince the people to come from all over the mountain to come and take the vaccination in certain amount of time, which is very limited. Can you imagine if we had Infuse back then? That was 2016. Can you imagine if we have Infuse, the amount of budget that we can save, and we can use it elsewhere to help more people? So I believe Gavi is actually connecting the dots, and this is what's needed for now for the health sector. And the most important thing in the conflict area, which is the devastating part, that the first thing it's really important to support is the health sector.
Thank you very much. And yeah, I mean, the way we think about Gavi is that we're one of the interventions that reaches the most children in the world.
Yeah.
I mean, I mentioned that 1 in 7 children doesn't get any vaccines, so we've got a lot of work left to do. But at the same time, we provide a platform for other health interventions and other interventions more generally, because we're that point of contact with so many children. When parents bring their children to the clinic for immunization, that's an opportunity to give advice to the mother or the father. It's an opportunity to provide, vitamin A tablets or other interventions. So to give bed nets to prevent malaria and so on. There are so many different things that can be done at that point when people bring their children to clinics for immunization. So this is really, we see ourselves as that kind of core of the primary health system. And as you say, data is really at the heart of this. You need to know who's been immunized and who hasn't. You need to know who's got a bed net and who hasn't. And how do we reach those children who haven't been reached so far? So it's absolutely vital. We found the same thing during the pandemic, that we were given an enormous task. Half the world's population lived in the countries that we were working with to roll out vaccines. But it was a really tough job, because nobody knew when we were set up whether the vaccines would work. Nobody knew if we would be able to raise money to buy the vaccines. And we didn't know if the countries could manage the scale up, because immunizing, really with the aim of immunizing several billion adults rather than 1 billion children, which is what we've done since 2000, trying to reach all of those adults. So it was an enormous task. And as I said earlier, I think we did make some progress. We think we saved 3 million lives with the vaccines we rolled out. But we know that we've got to do a lot better next time. So now I'd like to kind of discuss with the panel.
If I may add one thing.
Please, yes.
So I believe there is a crucial thing and a very valid thing that we have to do. In our work, we always pay respect for each and every community. So we don't have like a one-size-fits-all. So we need to study the community, understand the obstacle and the challenges. In this world now, it's ever-changing, and there is a lot of matter that you have to consider in each and every community. And this is, again, something that I really like about Gavi, that how you concentrate in each and every community and work on the challenges separately. This is something that we have to highlight with the work of Gavi as well, that we really appreciate.
Well, thank you for raising that. I mean, it's we need to operate at great scale, but we also need to be sensitive to each community because there are different challenges.
Absolutely.
There's how do you get the vaccines to different communities
Absolutely.
in the middle of the desert, up
Absolutely.
mountains, across rivers,
Absolutely. Yes.
and how do you deal with people's attitudes towards immunization, which can, particularly with social media these days, can be very
Misleading.
negative. That's something we need to tackle,
Yeah.
and where we work with social media companies to help get sensible messages across. But it also means working with every community, with religious leaders, community leaders, other influential people, to make sure that the vaccines are, people understand how powerful they are and how important they are. But one of the things, Mr. Akan, one of the things we faced as a big challenge in the pandemic was getting money right at the beginning of the pandemic, because really one of the things we have to do is convince the vaccine industry that it's worth, there's a market there for vaccines for low-income countries. And that's something we do in our daily business, because we raise money in 5-year cycles and we say, hey, there's a market here, we're going to be buying vaccines, so please make vaccines that are relevant for lower-income countries. But in the pandemic, it was a particular challenge because nobody knew the vaccines were going to work, and we had to raise a lot of money, So we raised more than $10 billion to buy COVID vaccines. But if we raised that money by June 2021, if we'd had $10 billion in June 2020, then I think the course of the pandemic would have been very different. And there's a particular gap very early in the pandemic where we really need to raise funds to convince people that this is an important issue and that manufacturers should pay attention. And that's really where we're looking at this new day zero financing facility. And I'm really interested in talking more to you, Mr. Akan, with your finance expertise about how we make that a reality, how we plug that gap in the first days of a pandemic. WHO says there's a pandemic happening and we need to be ready to act. So I'm really interested in your perspective on that and how we mobilize that really early finance.
Well, this is a very important question, and from an international perspective, what we have been doing is we're working with the WHO, we're working with the World Bank, we're working with the policymakers internationally on how we can ensure the surge financing, which is the day zero financing, and how we can make sure that if pandemic hits, we do have financing. And this is in fact part even of the INB discussion, the intergovernmental negotiating body, where we wanted to make sure that we do have a mechanism for pre-pandemic, during, and after. So the financing issue is discussed, and we also wanted to exercise and make sure that we utilize existing financing mechanisms. So therefore, we talk with multilateral development banks, the private sector, and I think asset managers here who are gathered in this forum, to look and work more closely with the private sector on how we can define areas of sustainable financing. Now, the biggest issue is that for manufacturer to know the demand, they should plan for it. So if a climate hits or if a pandemic hits, then they couldn't really plan how will they line up their manufacturing facilities. And we don't want to be in the same position where we were in COVID, where even production lines were shifting just to produce vaccinations. So we need to make sure that there is a proper financing mechanism and a sustainable one. And we need to make sure that we do have surge financing programs, and this is what the G20, the pandemic accord is targeting, and we wanted to make sure that multilateralism is working collaboratively. So the issue was how we can move from nationalism to more of multilateralism. And I think this is very, very important, and convening the discussion in platforms is very important. So I think the issue of financing is not only for vaccination, it is also for the overall health architecture, because we wanted to make sure that there is financing for workforce, financing for supply chain, financing for all end-to-end products. And therefore, we are in discussion in what it is called the medical countermeasure, where we wanted to ensure an end-to-end financing mechanism, an end-to-end program that involves supply chain until it goes to the arms of who needs those vaccines. So therefore, and I think the issue is not only climate change, it is not only manufacturing, it is an architecture and ensuring how we can have a holistic approach when we discuss this in terms of policymakers, where governments and sovereigns sit in tables and discuss, and working with colleagues from around the world, NGOs and private sector and whatnot. So I think what is happening now is very appealing. The WHO is convening this discussion. We discuss this at Gavi boards and Gavi other platform. The AMC is an important place, the Advanced Market Committee. So, and I think keeping on this discussion and providing solution and living up to the challenges is important to go forward.
Yeah, thank you. And that's so important with the G20 discussing this global architecture. So we need that level to work. We also need to go to every community, as you were saying. So it's really from the local to the global. I really like your expression, pop-up financing. I think that's great. I think that should be a thing. This is what we need: pop-up financing in the event of the next pandemic. So, you know, of course, at Gavi, we're following the international negotiations very closely about creating a new pandemic treaty so that we're better prepared for next time. It's really important the world gets organized, but we also need to be ready. We can't wait for the treaty to be signed and for that to be implemented. We've got to be ready to go. So that's really our priority, is making sure that financing mechanism is in place, making sure we've got the coalition ready to move in the event of a next pandemic. Because unfortunately, you know, scientists tell us that pandemics are going to be coming more frequently, partly as a result of climate change, urbanization, more mixing between people and animals, all of these things, deforestation, all of these things are bringing more opportunities for disease, unfortunately, to take off. So we need to get better at responding to pandemics. That's one of the real priorities. Nithya, how was your pandemic?
It was quite busy. I wanted to actually build on what Mr. Rakan was talking about in terms of this global architecture, because one of the things that we came out of the pandemic thinking a lot about is that we can't think about supply chains and refrigerators over here on the one hand, and then be thinking about vaccines over here on the other hand, that we really do need to be thinking about these together. And it's not just about the financing of these things, but also really about the data systems, how they're coming together. Because right now, increasingly what's happening is you have a lot of silos. You have some data over here, some data over there. And so one of the things that we've been doing that I'm realizing only right now as you're kind of talking about the global financing architecture is we're doing something really similar on the ground with countries, where we're actually helping countries think about, if I have 10 fridges failing, what is the actual impact of that on the vaccines in those fridges? So that I'm not just thinking about the money in the fridges, but I'm really thinking about what is the cost of the whole system to deliver those vaccines. And so one of the things we've been thinking a lot about is how do you help countries use their data to actually mobilize the resources they need in order to kind of keep supply chains running. And I'm thinking about now sort of on the fly, sort of how we start to map that on top of these global architectures as well, because there's a lot of, I think we can close the loop and kind of connect the dots in different ways. But so anyways, that was a lot of what for us the pandemic was about, was really thinking about how do we really help countries on the ground across every single node in the supply chain really bring their resources together.
Thank you very much. So we've got about 9 minutes left. So I'm looking to the audience if there are any comments or questions. I see two gentlemen here. First of all, gentleman in the blue jacket, and then gentleman at the front.
Daniel, thanks very much. I'm Alan Donnelly. I chair the G20 G7 Health and Development Partnership, and congratulations to Saudi Arabia to preside over the G20 in lockdown, but you still achieved a great deal. And of course, Gavi's work was critical. Well, it's critical generally, but in the pandemic, it saved many, many lives. I want to ask a specific question about the stage before we distribute vaccines and antibiotics, which is the development stage. And the problem is that when I was at the UN General Assembly recently, there was a discussion about stage 3 testing of a vaccine for TB, and they were scratching around looking for $60 million for it. And in the same way that Saudi Arabia will preside over the high-level ministerial meeting on AMR next year, which will be a big discussion everywhere, how can we get the finance, and you mentioned it, Daniel, released early enough, both for the development of the tools we need, because the next pandemic might not be a viral pandemic, it might be something else. How can we get the finance in place for the final stage development, and then, of course, getting countries to commit to buy these things so they're immediately available in the event of a problem? And we do have a pandemic, Rakan, as you know, with AMR, and you will play a very important leadership role next year to try and answer the financing question. Thank you.
Thank you very much. That's a great question, and it is one of the great challenges with vaccines. They are incredibly powerful, but they are biological products. They are difficult to develop and they're difficult to manufacture, and it takes a lot of upfront money to get through, as you say, the phase 3 trials, so that you can make sure the vaccines are absolutely safe before you start immunizing people. It's a big challenge, and I mean, Mr. Rakam, perhaps from the G20 discussions, this is something you can comment on.
Well, I thought you said we have 9 minutes, but I think this is 2 hours. But let me try to be brief. I think the AMR issue or the antimicrobial resistance issue is something of a silent and hidden pandemic that we should work very much in addressing this issue. And Saudi Arabia is going to host the high-level AMR conference in 2024 in November, and what we are working on is how we can address multi issues in the AMR, whether these financing or even other issues on how we can prevent this from happening. And I think by working collaboratively with the platforms that I have mentioned, in particular the INB discussion or the G20 platform, we're focusing now on how we can address these challenges in the Joint Finance and Health Task Force that is led by the G20, and we're in very close discussion with our Brazilian colleagues who will be leading the G20 next year. So I think addressing the AMR is a top priority, and it is something that we need to make sure we provide the necessary financing and to work with private sector, institutional investors as well on this area, and making sure that we address the prevention of AMR early stage.
Yeah, well, thank you. And you know, Gavi is very focused on AMR because vaccines are such a key part of preventing the diseases that then need to be treated with antibiotics. But I think in terms of your question about the financing the development of vaccines, that's not Gavi's job. Our board is very clear with us. That's not your job. Don't go there. Our job is to put the money on the table for the vaccine manufacturers and say, hey, there's a good market here. It's worth you investing in this vaccine. But I agree with you, there is a gap, and it's really important that that's tackled as part of the G20. Perhaps this gentleman at the front, good to hear your question. Thank you.
Thank you for your efforts. I am one of the vaccine victims. I have been affected with polio since childhood. My question to Her Royal Highness Princess Lamia, how you see the role of booster shoots can play to secure the future of global health, and what efforts or how you and Gavi working together to ensure equitable access for vaccine worldwide. Thank you.
Royal Highness.
Thank you for the question, and I would like to highlight how we go through this. Again, we go back to the data. If we have a very clear data, a number of people who's in need for vaccine, in each country, the amount of children, the amount of youth, and how we can create an awareness. For example, the measles and the rubella. There is a huge campaign that it's one of the reasons of autism. For example, people are refusing to taking this. Yet it's very dangerous for kids not to getting the vaccination because it can affect the full circle of the house. I believe back then it's a bit different than now. It's not that easy for an individual entity like Al Walid Philanthropy to force delivering vaccination for different communities. And that's why I highlight in the beginning the importance of the partnership between government and local organization. So it's not only coming back to us, it's coming back to the game or the players in the game. It's not only a decision, an individual decision, it's a work of a collaborative partner. Yeah, if I answer your question.
Thank you. And I think, Gavi provides a lot of vaccines to prevent polio, but we need to go further. And one of the new technologies we're helping to introduce is a vaccine that combines polio prevention with lots of other vaccines. And I think that's going to be an important part of the struggle, because it will increase coverage of that vaccine. So more children will be protected against polio. I think that's going to be a really important step in the next phase. Yeah. So we've only got 2 minutes left, so I think I'd like to turn to the panel for any concluding remarks or observations on what you've heard today, key points you'd like to emphasize. I'll start at the end with Nithya and work this way. So Nithya, perhaps you recognizing we only have a couple of minutes, but
some of I'd say the one thing that's really spoken out to me, especially as I've been talking with Her Royal Highness and Mr. Rakan, is trust and how important that is and how much time that takes. And just to echo something that Her Royal Highness said as well, is that's why we support Gavi, because the way that Gavi has approached building trust with countries is quite unique. It does take a lot of time. And for us, data is actually about underpinning and strengthening that trust. It's about building shared vulnerability, transparency, and kind of problem solving. So we're bringing everyone around the table together to work on solving these very knotty problems.
Thank you very much.
Well, I think the main outcome is to move to more multilateralism and to work on multilateral platform. And the only solution is international collaboration. And I think what we need to work more in these settings is to discuss the priorities and to make sure that we deliver outcome, which couldn't happen in national ways. It should be in multilateral collaboration.
Thank you. Royal Highness?
For me, it's partnership, transparency, and well-strategized plan.
Very, very well put. Thank you.
Thank you.
So I'll conclude by referring to the theme of this conference, which is all about compasses. And I mentioned earlier that there are 1 in 7 children in the world that doesn't receive any vaccines and doesn't get protected early in life. So whatever direction you're taking, whatever your journey, I think your compass should be focused towards helping us make sure those children get the right start in life. Thank you very much for coming today, and thank you to this panel for the discussion.
Thank you very much. Thank you.
Thank you. Thank you.
Thank you.